My name is Dr. Nwaonu, and I'm a rheumatologist at Trinity Mother Francis. I was originally born in England, but I've lived in various places throughout the world since then. I would say my parents, most definitely, they encouraged me from a young age. They were both in the medical profession, and they've essentially made me what I am today. Well, my father was a research scientist. He worked in a company in the United Kingdom. He used to bring a lot of his work home with him, so we used to look through microscopes and talk about different aspects of medicine, and that really interested me in medicine initially. My mother was a nurse. She used to take us to the hospital, and we used to see the other physicians there and the other nurses. And with those early influences in my life, that made me decide on a career in medicine as I grew older. Rheumatology is a very hands-on profession. You have a lot of contact with the patients. Most of the diseases in rheumatology are chronic diseases. You're going to see the patients for many, many years and try to help them cope with the diseases that they have. And that's what interests me in rheumatology, the close contact you have with the patient, the work you do with them, and the communication to help them get through what they're going through. Most of the diseases in rheumatology we cannot cure, we can only manage. And it's very important to have a close relationship with your patient to help them. Well, my husband has actually been employed by Trinity Mother Francis. He initially came down here for an interview and he loved the place. He liked the community. It was very warm, very friendly. The climate is great too. We're coming from colder climates. And he also has family down here, so he encouraged me to come down and interview as well. We both enjoyed our interviews here, and we've come down here to settle. It's a very family-friendly place too. It's a great place to raise children. We actually have 4 children, so it's a good place. The relationship between the doctor and the patient is extremely important. The patient's wishes and well-being are predominant. Everything else revolves around what the patient needs and what we can do to help them achieve their needs. And that is why I enjoy medicine, and that is why I practice medicine, to do as much as I can to help patients, to care for them, whether we can cure them or whether we can't, but at least to try and ease the conditions they're suffering from and help them live a more productive life.